Hi there, Mark Jaben here, Medical Director for Haywood County Health Department, and let's talk about this pandemic and where we are right now. The summary is we're seeing a continued decrease in cases, hospitalizations, and deaths. And remember last spring? Well, we're not quite yet to the lows we saw then, but we are getting quite close. And more on the new CDC community levels and what they mean in our region. So please share this with everyone you care about. For the United States, quite a change in just the past month. Only 2 states remain in the red this week. Half the states now all the way down in the yellow. For our neighbors, all now in the yellow. South Carolina with no counties in the red zone. Tennessee and Georgia also in the yellow, variable across each state, each still with pockets in the red zone. For North Carolina, new daily cases where they were between the Delta and Omicron spikes, around 1,500. And for perspective, as good as this is, the lowest rate was actually in May of 2021 when we had seen an average of 296 new daily cases. Deaths down, but still above the level seen between the time of Delta and the Omicron surges. Notice also 10 counties in the red zone in North Carolina, 53 in the orange. That's half the state. 36 all the way down into yellow. In western North Carolina, each county with lower numbers except for Clay, which was back up into the orange. Cherokee with large decrease, now down into the yellow, as is Henderson, and 3 more counties getting very close to the yellow range. Now remember, cases and test positivity tell about your risk of exposure right now. And for 8 of our 11 counties, there is still significant or substantial or high prevalence. The CDC community level, on the other hand, tries to predict the risk of serious outcomes in 3 weeks. And so for a minute, consider Cherokee and Clay, each with the same risk level, medium. But Clay with increased cases, Cherokee with a marked decrease. And herein lies where we must be careful interpreting these new community levels. Recall the level depends on hospital capacity. The actual data used depends on the health service area that the county is part of. So for instance, Cherokee and Clay are grouped together. Clay has no hospital, so it uses Cherokee's hospital numbers. Haywood County, for instance, goes with Buncombe, Henderson, Transylvania, and Madison, and this week is in the green or low community level by CDC. Across the entire health service area, new admits in the past 7 days averaged about 2.6 per 100,000 population. But for Haywood County, it was 13 per 100,000. That actually would put Haywood County in a medium risk, not a low risk for serious outcomes in 3 weeks. So be careful. The CDC metric for your county is not based on data from your county alone. As far as testing, no one above the 10% threshold now. First time in a long while. And 6 of the 11 now below the all-important 5% threshold. Haywood County, however, is not one of them. And speaking of Haywood County, now 12,845 cases for the pandemic. That's 50 additional reported over the past week. That's the lowest week-over-week increase since last May 2021. It's also the lowest number of new daily cases since early November 2021. But test positivity is 8.2%, still higher than at either of those times. So what's reported is likely lower than what's actually out there. Deaths, an additional 6 reported for a total of 199 for the pandemic. And note the increase during the 2-month period as cases fell for each surge, last winter with Delta and now with Omicron. Haywood Regional Medical Center averaged between 2 and 5 COVID-related admissions this past week. Currently, all of those admissions are not vaccinated except for 1. And the event risk calculator, low now for small groups of 10 and 20, lower but still large for the larger groups. A 30% chance in a group of 50 that someone there is infected, 50% chance in a group of 100. So be well and remain vigilant, especially right now.